Hello, welcome to the live video today. I'm excited about this one because I think I finally got it. It's a bit of a complicated issue, but yeah, I think we're done with it. So anyway, it's the Universal Healthcare Program in Kenya, and I think Uhuru is launching it today in Kisumu. That's the pilot program. It will start in 4 counties and then it will progress. And so here are main points for today, right? 1, it's a white elephant. 2, beware of Greeks bearing gifts. So let us begin. So what is universal healthcare? From the WHO, it just means that people would receive quality healthcare, right? And they would do so without financial hardship. That's the words they use. Without financial hardship, such that it should not be crippling for you and your family. And that's why there's a joke in Kenya that goes that you are one disease away from poverty. And that's true for most of us, for myself even. Just one disease away from poverty. So that's what the WHO says, that you should access healthcare, right, without financial hardship. And that's a good thing. So the 3 main aims are equity in access to healthcare, and the quality of healthcare should be good enough. So equity in access, good enough healthcare, and the people should be protected against financial risks, such that it should not be crippling, right? So here's the first point, right? There is nothing like equity in access to healthcare. It's even in the Bible, there shall always be poor people, right? But then we should always help them, right? But this is not the way to go. This is not the way to go. Where the government steps in, it needs to be some individual effort that comes into play. So anyway, just to go on right now, how did it all start? It started in 1948 when the World Health Organization declared that healthcare is a fundamental human right. That's what they declared, the World Health Organization. It's an unelected body, right? It is answerable to an unelected officials, and it decides on what human rights are. Who elected the heads of the WHO to say that, right? But anyway, that's beside the point. Another time there was a declaration in 1978 that health for all agenda. It was set as the Alma Ata Declaration, right? So you have 1948 where the WHO says it's a healthcare is a fundamental human right, and in 1978 you have the Alma Ata Declaration, health for all, right? Again, very noble concepts, right? Very noble concepts that people should receive healthcare. It should not be financially crippling, right? But again, this is not the way to go. Why? Because it's a white elephant, and because you need to beware of Greeks bearing gifts. I'll explain as we go. So anyway, during this pilot program, 3.2 million Kenyans will be able to benefit from it, right? And it will be from the 4 counties that I mentioned. Machakos is one of them, right? It's prone to road accidents, so that's why they chose it. Nyeri will be there also because it has a high level of non-communicable diseases. That's cancer, diabetes, and hypertension. India is the diabetes capital of the world. It seems that Kenya, the diabetes capital of Kenya is Nyeri. Isiolo, it has a high mortality rates, very, very high by the way. Isiolo is just bad for mortality rates. And Kisumu was also chosen because of like HIV and malaria. That's very high in Kisumu. So anyway, we see that the government chooses the kind of diseases that it will cater to. So that's also something that we might need to check out. And then it chooses specific regions. And then, yeah. So anyway, it's a pilot program. They want to see it, and then they want to spread it across the country. So not to dwell on that too much. What will they be catering to? They'll have outpatient services that will include medical illness, emergency healthcare, and consultation. How did they come up with those ones? There's inpatient care, where they'll cater to enhanced maternal and child services, enhanced HIV, tuberculosis, and malaria. So malaria, tuberculosis, and HIV, very understandable because there are very high rates of death when it comes to that. For the others, I did not know how they chose it. And then when it comes to, they'll do other services, like they'll distribute nets, again, to counter malaria. They'll do door-to-door immunization, I think for kids mostly, which is a good idea. I think it's been ongoing. And then there'll be public health education, civil society, and all of those things. Right, so anyway, the government will do all of these things, and then it will try and phase out to other counties as time goes. So let's go to Canada. What I wanted to say about Canada, right? Canada provides some services it has some kind of like public and private partnership where it provides for almost everything. Hospitals are publicly funded, right? They provide free care to its residents regardless of their ability to pay. So it doesn't matter if you can pay or not. You just get in and they'll provide free care. So I'm not sure if anybody would say that they have the ability to pay if the ability to pay doesn't matter. So anyway, Canada, but they don't provide all the services, right? They don't provide for vision, for dental care, and for prescription drugs, right? So they don't provide those services. So again, the government chooses which services to provide and which ones not to provide. An issue that might be looked at in future. So anyway, I hope that I've given an overview of what we expect in Kenya, right? Let's now get down to the points, like the white elephant. Why is it a white elephant? Because just an overview of what a white elephant is, right? Back in the day, the king of, which was this one, Burma, Thailand, Laos, and Cambodia, they used to have white elephants, and these things are very, very, very rare, and they're sacred. But the king would keep them as a symbol of his authority and of his wealth, right? And at times he'd give them as a present. And when he gives them as a present, you'd have to keep them, and then since it's sacred, then you can't use them. And they're taking up space and they're taking up resources. So you have something that's taking up a lot of resources, right? And it's sacred. You can't use it for plowing, or like what they mostly do for elephants in that region, right? So you can't use it. You have to keep it because it's from the king, and then you can't use it. So it's a white elephant. It's a useless gift, a blessing and a curse in your area. So that's what I think universal healthcare is. It's a blessing and a curse. For the countries that have adopted it, it has its faults, so many faults, and I'll mention them as we go. And but they can't get rid of it because now it's engraved in their society. They can't get rid of it, and if they try, there'll be chaos. So anyway, I'm hoping I've explained why I think it's a white, where the idea of white elephant comes from, right? Just to give another example, we already have a loan on this thing, on universal healthcare, because Japan gave us a loan of 3.28 billion to support these efforts of universal healthcare. So we already have some money into this thing, and if it doesn't work, we'll still have to pay that cash. Are you getting the white elephant where it's coming from? So we'd have something, perhaps it might not work, right? But we still have to pay for it. It's a blessing and a curse. And if you try to get rid of it in future, when it's engraved in our society, there'll be chaos. Are you getting where I'm going? So that's the importance of starting from a point where you actually analyze the thing before you bring it forward. So anyway, what happens in Japan, the ones who give us the loan, 30% of the cost for patient care, the patient takes care of it, 70% the government takes care of it, right? So that's Japan, one of the most, I think it's the third largest economy in the world. So that's what they do, right? Canada, it has a single payer system, right? Government takes care of 70% of the healthcare, right? So I think people would love that. When you go into the Kenyatta National Hospital, or when you go into Nairobi Hospital, and then the government takes 70% of the healthcare. Sounds nice. Sounds very, very, very nice. But is it? So anyway, here we start getting, how does the government do that? How does it do that? One, like in Japan, every 2 years, the healthcare industry and the health ministry, they meet and negotiate, and they have fixed prices, right, for every procedure and for every drug. So that cushions the government from overpaying, right? But then when you have a fixed price, it means that you don't have the market price, that the market price for that procedure, the market price for that drug might be either above the market price or below it. Now when it comes to Africa, it's highly likely that it will be above it, and these guys will be eating as much as they can. And in those countries, it might be below the market price, so they can't be as competitive as the other economies in those nations. There's a reasoning behind why government wants to set prices, right, when it comes to healthcare. And this is one of the reasoning that they give. There's somebody called Farmer Boy, and in September 2015, what he did, there's a drug, it's called Daraprim. I think it's a AIDS-related drug. It's really, really important, right? And so this guy, this drug was, he bought this company, it's called Turin, that was manufacturing this drug, Daraprim, and he raised the price from $13.5 to $750. $750. He was called Farmer Boy, and guys hated him for doing that because it's a very, very important drug, and people refer to him as one of the most hated guys in America. The government really wanted him, and they got him, I think, on some other charge, and they took him to prison. I think they did that mostly because what he did here was very bad. But that's America. It's freedom to set your own price, right? So that's one of the reasons why guys want to set prices for pharmaceuticals. So I'm thinking, you see, everything that it's done is usually done based on some given reasoning, right? Some justification. But at the end of the day, you remember that even when he raised those prices to 750, right? America was able to get to him through other processes, and it also had pharmaceutical companies that could manufacture alternatives at that time, or I think at this time, right? Let me now just move into the facts that I have. So I checked the top 23 pharmaceutical companies, right? America does not have a universal healthcare. It does not have that. But Canada, Japan, the UK, Switzerland, all of those countries have that kind of universal healthcare. 11 of the best of the top pharmaceutical, not of the best, but of the top pharmaceutical companies in terms of revenue and just in terms of size, they come from America. 11 out of 23 of them come from America. They come from a nation that does not have universal healthcare. Why? Because when you have the government negotiating and setting fixed prices, it reduces the incentive for these pharmaceutical companies to produce drugs, like what's happening in Japan. So the companies in America would be able now to produce as many drugs as they want, because the price is the market price, right? They can set the price. If the consumers don't want them, the competitors will develop a drug that will compete with theirs, and then they'll have to drop that price. As in, it's a very fluid system. It's a free market. And what happens with the free market? Companies flourish. And when companies flourish, the top pharmaceutical companies flourish, the people receive the benefits of that flourishment. They receive the best drugs. They receive the best drugs at the best prices, and all of those things. And that's why these other countries that have universal healthcare, they don't have the top pharmaceutical companies. Japan only has one amongst the top 23. America has 11. India, which does not have universal healthcare, has 2 of the top pharmaceutical companies in the world. Modi is going to bring something that he calls Modi Care. So I'm thinking the pharmaceutical companies in India will be dropping soon in terms of revenue and in terms of everything else, if they do not focus on the export market, because the local market, I think it's about to become hectic for pharmaceutical companies. But I'm hoping that you're getting that one. So anyway, there's something they call OECD. It stands for the Organization for Economic Cooperation and Development. It's like a rich countries club. 36 countries which are rich, and they sit, they compare, they gossip, all of those things. So anyway, in these countries, there's a research that was done, and the general medical practitioners, right? The highest earners, they came from the United States. The highest earners came from the United States. Why did they come from the United States? Because of this, right? When the government steps into the market, right, it sets the prices, and it sets the prices for the procedures, like in Japan. The people performing those procedures are doctors, right? And doctors might not receive the market price for their training, for their work, for the procedure that they are doing. So when it's it means that if the price for a procedure is, let's say, at X, right? In Japan, they are fixed at X, where it's supposed to be at Y. It means the American doctor will receive value for his money, but the Japanese doctor won't, right? So there'd be no incentive for the Japanese doctor to do the best that he can. Again, it's the free market. There's the idea of the free market, where when you receive value for your money, you work harder so that you can get more money. But when it's fixed, somebody fixes it, then it reduces the incentives to produce, because you don't have as much profit. So anyway, that's the US. It has the highest general practitioners earners. So compared to Canada, where the government pays 70% of the healthcare, self-employed general practitioners in the United States earn 40% more than those in Canada. That's 40% more. So I'm hoping that you can see how it goes. When you put the government into a system, the value that people are supposed to receive for their services drops. And in this case, you might say that it's kind of like 40%. So yeah, so that's what happens in the United States when it comes to general practitioners, right? When it comes to remuneration of specialists, the Netherlands is the highest, followed by the United States, Luxembourg, Austria, and Canada. Again, the United States is still at the top, right? And when it comes to specialists, I'll give an example why. I'll tell you why the US is not at the top, because it's supposed to be at the top. So anyway, so that was OECD, the Rich Boys Club in the countries, around 36 Rich Boys Club. So let's go to Canada, right? 56.3% of the patients in Canada, right, they have to wait 4 weeks to see a specialist. 56.3%. They have to wait 4 weeks to see a specialist. The ones that I can afford to move to other areas to find specialists, they go to the United States. So many patients, they are tired of waiting for specialists in Canada. They go to the United States. They move from a place where there is universal health coverage, they go to a place where there is none. Why? Because the market system is working over there. I'm hoping to get that. And then, in the US, 4.9% wait for more than 4 weeks to see a specialist. Wait for 4, that's 56.3% in Canada, right? 4.9% in the United States. You're getting how the free market works. Now, think about a specialist. Seeing a specialist it's not like a general practitioner where you just go to any doctor and he treats you. A specialist is something that you really, really need, and that a disease that is specific to you. And it's very, very bad to, and that's why because when it's very high, when it's very difficult for you to see a specialist, right, then they can raise the price, right? They become more, not even price, because now the government is fixing the prices, but they become more scarce within the economy, right? And when they become more, in the US, since they're not as scarce, it's only 4.9%, then the price they receive would drop, right? Because they're easily found within the economy. So that's why the US is not at the top when it comes to specialists. Netherlands has beaten it, right? But it's still the top in terms of what specialists earn, right? So anyway, I hope you're getting it. From 56.3%, they have to wait 4 weeks to see a specialist. In the US, 4.9% wait for 4 weeks to see a specialist. So anyway, just to try and rush, let's go. I'm hoping that you have seen that, right? The impact of universal healthcare on the availability of specialists and all of those things. It's most difficult to access healthcare. Alright, let's go to foreign trained doctors, right? Training a doctor takes time. I think it's an average of 6 years or something. And it's expensive. It's very, very expensive. So what happens is that when the government fixes the prices, it reduces the incentive for doctors to earn as much as they can. And then the training for doctors is still expensive. Then they'll go outside and find doctors from where? From Africa and from other third developing countries. And then for us, we have spent so much training this doctor, and then the Canada and the other countries, okay, even the US, because I'll mention that, they'll pick these doctors from us. Because the universal healthcare system over there is not working, so they'll drain our doctors to go there, right? And that's how brain drain starts, and then that's how it works. So it will affect us. The universal healthcare over there will affect us, even though we do not know it, even though we do not see it. So anyway, let's go to this one because I really, really want to. So let's set Israel has a universal healthcare. 58% of its doctors are foreign trained. Let's go to Australia has universal healthcare. 30.5% of the doctors are foreign trained, right? United Kingdom has universal healthcare. 28.3% of the doctors are foreign trained. Switzerland 27% of the doctors are foreign trained. So I'm hoping that you're seeing that, right? That it's no longer profitable for people to become doctors as much as it was in a free economy. When the government steps in, it sets prices for procedures, for drugs, and all of those things, controls the market. Then you really don't want to get into that industry because there's no money, right? And you still have a lot of debt in terms of student debt because you train there. So what do? You say, whatever, let me go and become a lawyer or something like that. So there'll be a deficit of doctors, and they'll take those doctors from Africa, from certain countries in Asia, and from South America, right? So I'm hoping that you get that. Now, the United States has 25% foreign trained doctors, right? And I'll tell you why it's still drawing doctors. So anyway, here's another funny thing, right? To keep the prices low in the UK, right? Some expensive and uncommon drugs aren't available. So the government control, it has its impact. When the government wants everybody to be happy, utopia, the utopia kind of thinking, where you go, the drugs are cheap, and you get the drugs, and then you use them and all of that kind of stuff. Anyway, so what happens is that the government just decides, get those drugs. They're expensive, they're uncommon. Don't you need uncommon drugs? There are common drugs over there. So anyway, I'm hoping that you get the point. There's a lot of government control, and it moves to a certain point where it cannot afford certain drugs. It just moves them out of the market. What if it moves the drugs that you want out of the market? What happens to you, right? So anyway, the US, one of the reasons why it has a high number of foreign trained doctors is that it has a mixture of government run and private insurance, right? Like I think we've heard of Obamacare, right? It's just bad. Obamacare was just bad. Anyway, 1/3 of the costs went to administration, not to patient care, right? So the government is spending on administration, and we all know what happens when people receive money from the government from administration. They just hike costs. At the end of the day, it doesn't help. So anyway, that was my point. I'm hoping that I've got it across, right? When government moves in, pharmaceutical companies, they don't have incentive. Doctors don't receive the kind of money that they need to receive, and then patients, they suffer because now they have to wait longer for doctors. There's a scarcity that develops, and when that scarcity develops, therefore the developed world, they can take our doctors, right? So Africa has a deficit. We'll have a deficit because of them, right? So for us, when you bring in universal healthcare and all of these things happen, where will you take the doctors? Where will you take them from, right? So anyway, just trying to finish. So beware of Greeks bearing gifts. Poverty is not an accident. That was what Nelson Mandela said. The Greeks bearing gifts was the time that the Greeks came to the shores of Troy. They left that horse, and it was a gift to the Trojans. Yeah, okay, so they brought in that gift, and what happened? There were soldiers hiding in there, and they were able to conquer the city of Troy. So beware of Greeks bearing gifts. And this is what is happening. The president is going there bearing gifts in Kisumu. And it's dangerous. I believe that it's dangerous. So, just to give an example of universal healthcare, like in Makueni, everybody is praising Kivutha Kibwana. He's doing good work, but again, these utopian ideas that people don't really appreciate, right? Their impact. Like he says that in his constituency, 162,000 households, they should pay 500 a year, and then with that, he's able to provide universal health coverage. So again, the government is determining how much of your income it will take, right? As if we're not already overtaxed. It's again deciding what kind of income it will take from you, right? Today it will be 500, tomorrow it will be 1,000, at the same time it will be 1,500. And then when you go to the hospital, you find a scarcity of doctors. You find that they've taken some drugs off because they're too expensive, right? You find all of these things, and it's a bit dangerous, right? And doctors don't receive as much income as they should receive. Now they have more incentive to go to other countries. You get what I'm saying? So at the end of the day, these things, we need to interrogate them a bit further. I'm hoping that we will. What Kivu the Kibwana is trying is what Japan tried. All residents of Japan are required by law to have health insurance coverage. So you have to pay some premium, and then now the government will pay. So you give money to the government, and the government give it to you back. In between, it has taken a lot of value from it. So you don't receive what you had given. You receive less. Okay. The UK runs hospitals and doctors and pays them as employees. The government pays 80% of the cost through general taxes. So at the end of the day, what they do is just they take more taxes, So if Kibuda starts with 500, he'll take more. Eventually, when we're tired, he'll just start taking off the procedures and the drugs from the list of things that you can enjoy. So why am I feeling that this is a very, very bad idea, right? Because people can actually pay for their own healthcare. Give an example. The fisheries industry, this is somebody who said, I got it from the Standard, it could inject 245 billion into the Kenyan economy annually. 245 billion into the economy annually. But it's not doing that. Why? Because China is injecting fish into the economy, right? It was at 1 billion, I think, in 2015. I think by the end of this year, it will be around 2 billion worth of fish into the Kenyan economy. So we're killing 70% of dry fish and tilapia sold at a market in Kisumu. It's called Jubilee. Is from China. 70% is from China. The lake is just there, but the fish is from China. And you're wondering what's up. And then there's, I think, another statistic that I had. Fish production in the lake has plummeted by 50% in the past decade. So instead of giving people universal healthcare, give them an industry. Allow them to fish, right? Stop interfering into that market also, and then coming and cheating them with the universal healthcare. Kenya, we spent 2016 to 2017. We allocated 60.9 billion to the healthcare sector. 60.9 billion to the healthcare sector. And if we take care of the fish industry well, we'll have 245 billion. We'll have 4 times what we spent on healthcare on healthcare in 2016-2017. 4 times if we take care of the fishes industry. Are you getting what I'm saying? They are playing with us. It's just playing with us. And we need to stop being played. We just need to stop. Again, look at the maize industry, right? They're telling us now to shift to avocados. If we take care of that industry, right? Do we really, if the farmers are able to receive what they should receive, do they really need universal healthcare? Because they'd have their own money to pay for that, right? So that's the point I'm trying to say, that these ideas, they're utopian. They are there because eventually you'll see people will steal a lot from this one, and they are there just to steal, to create an illusion for the people. We can actually pay for our own healthcare. It will become cheaper if we pay for it, right? Because the market forces would be working. We'd have the best pharmaceutical companies. We'd have the best trained doctors. Another statistic that I didn't give. Anytime we go and search for the best doctors in the world, the US is at the top. It's at the top, right? The best doctors, the US is always at the top, right? So anyway, that's what I had. And I'm hoping that you guys are listening. And I'm hoping that you are sharing. Because these are utopian ideas. And they'll lead to a significant impact on our economy and on our future. And it will not help our health sector. Stop lying to the people. Let the industries work for them. Let them have money in their pockets. 245 billion. We can give 60 billion to that healthcare industry and still have another 180 billion to spend. They should not lie to us. That is what I had today. I'll see you tomorrow at 5 p.m. Goodbye.